And welcome to the special meeting of the Health Committee. It is Wednesday, September 27th. I am calling the meeting to order. As we gather this morning, I wish to acknowledge, on behalf of committee and our community, that we are meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We're extremely grateful for their many and continuing displays of friendship. We thank also all the generations of people who have been careful stewards of this land for millennia. I would inquire, Ms. Chaput, has the roll been called?
Yes, we have quorum.
Thank you so much. We have quorum. With that, we have a single piece of business. There are a couple of items, but we have just the Emergency Services Department report this morning. I would invite Deputy Chief Grenier, if you could take us through the report, please.
Thank you, Chair. First bylaw, 2023-2024 virtual care program, virtual triage and assessment center. The recommendation for committee, that the Health Committee recommend that County Council adopt a bylaw that amend bylaw 103-22 signed in June 28, 2023 for amend agreement between County of Renfrew and Ontario Health for funding to support Renfrew County Virtual Triage and Assessment Center for a term of April 1st, 2023 and ending March 31st, 2024, including natural funding for physician compensation in the amount of $1,316,250 for a total of $4,416,250.
Thank you very much, Deputy Chief. Could I have a mover, please? Councillor Grills, seconded by Councillor Yon. Back to you for background, please, Deputy Chief.
So the background is attached on the Appendix ES 6, a letter from Ontario Health, including a 2-week period turnaround for signature that would amend and increase the amount of funding we receive for physician compensation. This is a good news story. We have strong evidence that virtual care improve patient caregiver experience in the county. Also, virtual care can improve patient-provider experience, population health, and advance health equity. The Renfrew County VTAC as supporting the residents of Renfrew through innovative community-based hybrid model, and this extra funding will increase program capacity and services.
Thank you very much. Just before I open the floor for questions and comments, I think that it might provide some grounding if committee views both item 1 and 2 kind of through a single lens. Item 1 is where we're bringing it in, and item 2 is where we're sending it back out again. So perhaps your questions may, if you have any, may incorporate both items. But for now, item 1 and this bylaw is before us. Any questions or comments? I see none. All in favor? That is carried. Opposed, if any? I see none. Thank you. Back to you then, Deputy Chief. Moving on to item 2, please.
Thank you, Chair. Second bylaw, memorandum of understanding between the County of Renfrew and the Petawawa Centennial Family Health Team. And the recommendation is that Health Committee recommend County Council to adopt a bylaw authorizing the Warden and CEO Clark to sign that memorandum of understanding between the County of Renfrew and the Petawawa Centennial Family Health Team for the administration of the integrated virtual care component of VTAC program to provide attachment for previous unattached patient and provide physician services to the VTAC and IVC program.
Thank you, Deputy Chief Grenier. Could I once again have a mover, please? Councillor Murphy, seconded by Councillor Weir. Background, please, Deputy Chief.
Thank you. The purpose of this memorandum is attached in the Appendix 7. Basically is to take full advantage of the expertise of the Petawawa Centennial Family Health Team clarify role, responsibility, and mutual expectation between the County of Renfrew Paramedic Services and the Family Health Team. Is to ensure efficient operation of the integrated virtual care. The MOU will be in effect from July 1st, 2023 until March 30, 2024, unless extension mutual agreed again, and it can be terminated in any provision in 30 days. Just to give committee a view on the impact of IVC so far, we have rostered almost 3,000 patients with an attached named physician thus far, and we hope to continue to do the same ratio moving forward.
Thank you very much. I also have sympathy for you on deciphering Roman numerals. They are used exclusively now in reports from the County of Renfrew and Super Bowls. Any questions or comments on item number 2? I see none. All in favor? That is carried. Any opposed? I ask because there's a lot more than committee in here, and I see a lot of councillors, and I'm not sure if they sit with their hands by their sides. I do see none opposed. The motion is carried. Thank you. With that, the date of our next meeting, you'll be pleased to know, is Wednesday, October 11th, 2023. I would now seek a motion to adjourn.
Chair, the report as a whole. I'm sorry. Thank you, sir.
Thank you. I would now seek a motion to approve the report as a whole, please. Councillor Weir, seconded by Councillor Wilmer. All in favor? That is carried. Thank you. Now, I would seek a motion to adjourn, please. Councillor Yon, seconded by Councillor Weir. Apologies, Councillor Lafreniere. I am actually going to take Councillor Lafreniere as the seconder, so as to appear in the minutes of today's meeting. Thank you so much. All in favor? That is carried. We are adjourned. Thank you very much.